Hey, Tom here with Dependable Oxygen. Today we're going to talk about sleep apnea, what it is and how it's diagnosed and how to get treatment. So what is sleep apnea? Sleep apnea is when you go to sleep and you'll have episodes where you stop breathing. So a lot of it's manifested by snore. So if you're a loud snorer and there's a lot of snoring going on, that's usually a good indication and a sign. If you're tired all the time, that's a good indication. They call that daytime somnolence, where you're just tired during the day. Fatigued, if you forget things. Forgetfulness is another side effect. It can also affect your brain, cause anxiety and depression. It can also cause sexual dysfunction in men, some other things. So it's something you don't want to take lightly. It's something that's treatable. It's about 25% in men, middle-aged men, and about 9% in women. And as we get older, those statistics go up. I've seen it in as young as babies, infant babies, and in fact they've said that SIDS is actually a form of sleep apnea, all the way up to adults and the elderly. So it doesn't discriminate. It can happen at any time. There's two types of sleep apnea. The first type is called obstructive sleep apnea. Obstructive sleep apnea typically indicates an obstruction, the upper airway actually closing off. So it's the airway when you relax, you get into your REM sleep. It typically happens when you get into REM sleep, your muscles relax in your body. And with some people, their muscles relax so much that the airways and the muscles relax in the airway and they will close off. So what they consider a complete apnea, where there's no air coming in or out, that's called an apnea. Nothing coming in, nothing coming out. And I've seen episodes from 15 seconds up to over 4 minutes. The other kind is called a hypopnea. Hypopneas are the airway shallowing off, but you may not completely close up. But it's a reduction in flow. So if you're breathing in 20 liters of oxygen, it's a reduction in flow in 30% or more. So if your normal breaths are this much and you are breathing this much, that's called a hypopnea. So the second type is called central sleep apnea. Central sleep apnea has nothing to do with the obstructions. Central sleep apnea is just the signal from the brain not getting sent to the lungs to breathe. It's fairly simple. Why it occurs, there can be a lot of factors. It can be neurological. I've seen people that have partially paralyzed diaphragms, so that's not working. It can be caused by sleep medications and pain pills. Pain pills can cause central sleep apnea. It causes episodes where people don't breathe properly. And then you've got a third category where you get mixed. And these guys have obstructions and the signal's not being sent. That's the worst and most severe. Typically, in order to see treatment, what we do is have patients seen by their doctor and have it diagnosed. The first step that we usually do is have an overnight oximetry done. And that's just putting a probe on your finger and you sleep with that at night. So this is an overnight oximetry. This is an oximeter. Simply turn it on. This will start recording your data. You go to sleep. It's just got a little probe on your finger. And this will record your oxygen levels and your heart rate at night. And those typically will come back, and if we see desaturation events, that's a signal of sleep apnea. Then you can go on for further testing if this is positive. The second part of that is going in for an actual sleep study. Okay, so we're in the sleep lab room. So typically when you come in, you'll come into the sleep lab. They'll hook up a bunch of different probes. So you can see all of these. They will hook them up. You will have one that'll get brain waves, EEG. You'll have one that'll do EKG. Then they'll have stuff for flow. They'll have stuff for chest movement. They also have some video stuff so they can kind of watch you if you have leg movements and those sorts of things. all these help diagnose different things, and we'll go into details. But the brain waves are important to get a sleep study done in a lab versus getting one at the home, because knowing what stage of sleep that you're in is really critical, because most of the time sleep apnea occurs in REM sleep. Sleep apnea can really affect the brain chemistry of a brain, and then they've actually looked at them in the brain chemistry in people who have sleep apnea versus normal. It's different. And there's not been a lot of studies on why, but there's some theories, and my 20 years of doing this, I've got my theories. But the brain needs REM sleep. It's its time off. It's its time to dream. It's its time to relax. So if the time when you're in REM sleep, you're having these episodes, the airway's closing off because your muscles relax, what happens is that trigger, that response goes back up to your brain that says, hey, we're not getting enough oxygen, you need to wake up. So what we typically see is a normal brain wants about 20% REM sleep during the night. So if they look at normal studies, the brain will go into certain stages of sleep, and if you're getting 20% REM sleep during the night, you're doing good. What I see most of the time is these guys come back from getting their sleep studies done, and I've seen it anywhere from 0% REM sleep to maybe 5. The average is about 10. So you're losing a lot of your REM sleep. The brain chemistry and the brain, everything is so important in there because it changes. My theory is it changes because you're not getting the sleep you need. It wants to have that REM time and that time to relax, and if it doesn't get it, and for a lack of a better word, it kind of rebels on you. So that's why it causes anxiety. That's why it's causing depression. That's why it's causing you to be tired during the day. You can sleep 20 hours and still wake up and feel tired because you need REM sleep. REM sleep is what makes you feel woke up and ready to go. So once you get on a successful treatment, what we're really trying to do, my thing and what I tell people we're trying to treat, we're really trying to treat your REM. We're not trying to treat everything else. We're trying to get you that REM sleep back so your brain function can get back to where it is, so you can have normal activities during the day. So getting good restored sleep is very, very important. And getting treated for it is very, very important for your long-term health, mental health, and physical health. Physically, you hear a lot of the physical sides of it. You don't hear a lot of the mental sides of sleep apnea. But a lot of the anxiety, a lot of depression is caused from not getting sleep. It also causes, the physical side of it, causes high blood pressure. It can cause congestive heart failure because you're not getting enough oxygen and you're having struggle sleeping. And it also can cause strokes and heart attack. But usually it's not an overnight thing. It's a 10 or 15 year period for those things to happen. So what happens, we usually see the onset of patients having this issue when they're in their 30s is the onset. But you're not going to see problems with their heart and stuff like that until they're in their 50s or 60s, and depending on when the onset is. So the sooner you treat it, the better it is for you. So even if you think you're in your 30s and you're okay and it's just mild, you don't need to worry about it. That's fine. Hey, you might be all right, but the reality of it is you're not fine. And down the road, it's going to get worse and worse and worse. It's progressive, and it's going to cause problems big time down the road. All right. So hopefully you've got a little something out of our overview. What I kind of want to wrap up and let you know is just talk to your doctor, get diagnosed properly, and start with doing an overnight and maybe a sleep study and get it checked out if you suspect you have it. Get it treated. It's a very serious issue. Tune into the next one. We will talk about how to treat.